Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hello, I'm Sally Hodder. I'm a professor of medicine at West Virginia University, and welcome to episode 3 of Clinical Clips. Despite widely available daily antiretroviral regimens, some people living with HIV are unable to attain virologic suppression due to adherence challenges. And yet, is it possible that our new long-acting regimens will really effectively address some of these challenges? As you know, in the phase 3 trials of many of these long-acting agents, individuals who were not suppressed or had virologic failure in the past were not eligible. And so today, ACTG 5359, presented by Dr. Rana, sought to address just that question. People with HIV were eligible if they had a history of a poor response to antiretroviral therapy, or if they had been lost to follow-up, resulting in a lapse in adherence. And they were enrolled in step 1 of the study, which could last up to 24 weeks, included monetary incentives and adherence coaching. And 434 individuals were enrolled in step 1. In step 2, if individuals were virologically suppressed, they were then admitted to step 2, where there was a 1-to-1 randomization to either cabotegravir and long-acting rilpivirine or a standard of care oral ART arm. I thought this was amazing. 93% of injections were given on time, and only 3% missed injections, which I felt that was unbelievable, particularly given the population. And if we look at outcomes for virologic failure, among those in the long-acting arm, 7.2%, or 6 individuals, had virologic failure, compared with 25.4, or 28 individuals in the standard of care arm. If we look at all treatment-related failure, not just virologic failure, it was similar. Noteworthy is that of the 6 virologic failures in the long-acting arm, 2 had emergent integrase-resistant mutations. Based on the virologic and treatment failure results, the DSMB recommended this past February to stop enrollment, which has been done, though there will be continued follow-up. And, you know, in summary, I think that long-acting agents for the 2 parameters I mentioned had established superiority. And I think the real take-home is there is promise for every individual with HIV, even those that have had adherence challenges, and it hopefully will have other studies and interventions to really address this important group. A second study presented today addressing a special population is that of adolescents. And as we know, adherence for ART can be particularly problematic in that group. Impact 2017, or the MOCA study, looked at adolescents and switched individuals who were virologically suppressed from their background antiretroviral regimen to long-acting cabotegravir and rilpivirine. There was a 4-week oral entry, and then there is a, following the single-arm study, out to 96 weeks. There were no confirmed virologic failures in this study, and 35%, if we look at safety, had injection site reactions, which was not surprising, and most resolved in 7 days. There were no deaths or life-threatening events seen. Now, an amazing thing is 99% of participants preferred long-acting regimens over oral medications. And finally, PK proved to be comparable to that had been observed in adults and were above the IC90. Follow-up of this cohort is continuing out to week 96, and it'll be interesting to see how they proceed. Another long-acting regimen that was presented today, not in any particular special group, but was that looking at islatravir and lenacapavir given weekly. And the study design, it was an open label phase 2 study of individuals who were suppressed on bictegravir, FTC, and tenofovir alafenamide, BF-TAF from here on out. And individuals were randomized 1-to-1 to stay on BF-TAF or to have islatravir 2 milligrams plus lenacapavir 300 milligrams orally Q weekly. Looking at the results, at week 24, 94% in each arm had suppressed viral load. There was one individual in the islatravir lenacapavir arm who had at week 24 a viral load greater than 50 copies. It was 251 copies, but that individual resuppressed by week 30 on the islatravir and lenacapavir arm. And I think that this just illustrates another novel regimen. This one is oral Q week, but I think what we're really sort of seeing is the evolution of options, whether it's Q2 month injection or weekly oral, that really take us beyond just one tablet once a day and provide options for our patients in a much more inclusive fashion. And finally, I'd like to finish today's clip by mentioning the Impact 11-15 study that looked at neonates who were infected in utero and were treated within 48 hours of delivery with antiretroviral therapy. This study has been going on for years. It started in 2015, building on the observation in the Mississippi baby in 2013 that the baby had sustained no detectable viral load for a period of time off antiretrovirals. In this study, 54 individuals received the ART within 48 hours, and 6 children met the eligibility criteria for discontinuation for ART, and those criteria were quite extensive. Of the 6 individuals who met the eligibility criteria and discontinued antiretroviral, 4 of 6 achieved HIV remission, which was redefined as absence of replicating virus for at least 48 weeks off antiretroviral therapy. 2 of the 6 babies had rebound within, one within 3 weeks and one within 8 weeks of stopping antiretrovirals. Noteworthy is that 2 of the children that rebounded, one who rebounded early and the child that rebounded after 80 weeks being off antiretroviral therapy, had acute retroviral syndrome, which I think really highlights the importance in these studies of very, very close follow-up of these individuals. Noteworthy is that this study was done before the advent and the availability of some of our more potent long-acting agents that at the time the study was going on had not been studied in children. And I think what will be interesting is whether use of more contemporary antiretroviral regimens will result in increased remission. But nonetheless, I think these findings are critically important to research, particularly cure research, as we really understand what happens. And this study clearly shows that very early antiretroviral therapy among children who were infected with HIV intrauterally really limits the size of the reservoir of HIV. Thank you for joining us for episode 3, and please refer to the landing page for slides, and be sure to come back tomorrow for our 4th and final episode from CROI 2024.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.